The vessels in red, vessels transporting oxygenated blood. The one in blue would be vessels transporting deoxygenated blood or low oxygen, no? And then the one with a different color, like a lavender, that would be vessels involved in gas exchange. Anyway, you are, I'm sure you have finished this in your anatomy, no? Okay, let's talk about the heart, especially now that the Valentine is fast approaching. Okay, Balderian, are you sleeping? Heart.
No,
No. Okay, good. So this is your heart, and these are the structures of your heart. This is very elementary. You know this, okay? You have your four parts: the right atrium and the left atrium, and then you have your superior vena cava, okay? And you have your sinoatrial node, the pacemaker, internodal pathway, the pathway where this where the stimulation of the pacemaker would pass through the atrioventricular bundle of his, the right bundle, and then the Purkinje fibers with an R. Okay. So anyway, this is only a schematic diagram. Okay, here. Another picture of your heart, the right and left, and the right ventricle and the left ventricle. You have the valves, tricuspid on the right, and on the left, the mitral valve. You have your chorda tendineae. Okay. You have your, here, you have your pulmonary valve. Okay. And you have your bicuspid or mitral valve. You have your papillary muscle. This, you would see it is a muscle. And then, of course, you have the chorda tendineae here. Okay, so this is a frontal section. The walls of the heart. The three layers, okay, from within. You have your endocardium, the myocardium, and the epicardium. The pericardium, okay, the entire layer, okay. So starting from the inner, you will have your endocardium, inner endothelial lining covering the trabeculae. These are the trabeculae. And then you have your myocardium from here to here. That would be your muscle layer. This is the myocardium. And then you will have your serous pericardium. There you are. And then you have your space. And then you have your parietal layer of your serous pericardium. And then your fibrous pericardium. All of these would correspond to the pericardium. Endocardium, we shall describe now from inner part. Endocardium, thin layer of endothelium and supporting connective tissue. That is your endocardium. It is a middle myoelastic layer of smooth muscles and connective tissue. Beneath the endocardium, you have your subendocardium, a deep layer of connective tissue. You will find here your modified cardiac muscles, and then the impulse conducting system of the heart, which we have mentioned, the sinoatrial, or atrioventricular, and so on. Endocardium. The endocardium here, you would see, okay, you have your endocardium, okay. You have here the endocardium, this entire part. And you will see here your P representing your Purkinje fibers. These are the modified muscles, cardiac muscles, Purkinje fibers. And then you have here the myocardium, this thick here, all the muscles, uh, myocardium. Okay. Now you have we describe your endothelium. The endothelium is a single layer of squamous epithelium. Okay, you have taken this epithelial tissues. This is squamous epithelium lines all internal components of blood and lymphatic system. So all your blood vessels, all your lymphatic vessels, they are lined by endothelium. Okay, and then selectively permeable. This is their one characteristic. And this has an anti-thrombonic permeability. Okay. Okay, there is an anti-thrombogenic barrier. So this does not, have a destruction of the red blood cell when it passes through this. And then determines diapedesis. Diapedesis is a property of the red blood cells to pass through, or the cells within the blood vessels to pass through in the endothelium. Okay, so your endothelium must be able to let this diapedesis process be completed. And then endothelium secretes paracrine factors for vessel dilation, constriction, growth of adjacent cells. So these are the characteristics, descriptions of your endothelium. There you are, another view. Okay, Purkinje fiber with an R. These are modified cardiac muscle cells located in the atrioventricular bundle and its branches. They have reduced number of myofibrils. There are more sarcoplasm, okay, sarcoplasm, and abundant glycogen. The Purkinje fiber, they have more rounded nucleus in groups of 2 or more. They are larger in diameter, and they lack transverse tubules of cardiac muscles. So they are called the modified cardiac muscle cells, or Purkinje fiber. Okay, here's your Purkinje fibers. Okay, here. Okay, these are Purkinje fibers. You have your endothelium. Okay, there's single lining with a squamous. Okay, squamous epithelium. Okay, this is your muscles, your cardiac muscles. You see the difference, okay, with the Purkinje. Okay, these are all cardiac muscles. The myocardium, the next layer, this is the thickest layer, spirally arranged cardiac muscles. Of course, in the ventricles, you have thicker compared to the atrial, okay, area. Strands of connective tissues and vascular network in between cells. So you will see connective tissues and blood vessels, no? Okay, in between these myocardial cells. The myocardium, also they are known as cardiac muscle cells. They are striated. Okay, they are like the skeletal muscles. They have striations. It is involuntary, similar to your smooth muscles. Cylindrical with branching. So this is the way you describe the the cardiac muscle cells, no? Cylindrical with branching, while your skeletal muscles cylindrical with blunt ends, Yes, any what's that? What's that noise, huh? What's the problem with that noise? Please, when I conduct my lecture, I would like you to be completely quiet. No, please do not make any disturbance because I'm allergic to it. Your job is to listen, to take notes perhaps, but not to disrupt me. Is that clear? Is that clear,
Yes,
class?
Doc.
Yes, Doc.
Who made that noise? Who made that noise? See to it that your background are okay, no? And you should not be disturbed by anyone in your place. Because I am also disturbed here. If I will be disturbed and I will stop my lecture, you will be responsible for the topic. Because anyway, it's all in the book. What I'm saying are all in the book, even the pictures. If you have read before, these are there in your book. So if you'll make this disturbance on me, any one of you, I'll stop lecturing and you are responsible. Anyway, you are mature enough to read. Read and read. Okay. Please do not make any kind of this disturbance. I am pissed off immediately. Okay. So your cardiac muscle cells, you know that they are mononucleated or binucleated. Mononucleated or binucleated. It is centrally located nucleus, and the presence of intercalated discs gives you a distinct character of your cardiac muscle cells, intercalated discs. Cardiac muscle. So you have here the nucleus. Okay, they may be two. Okay, binucleated or mononucleated. Okay, and here is your intercalated discs. Okay, intercalated discs. Okay, okay. This one here, this is your desmosome. This is an example of a junction. We will talk it later on. Okay, this is your myocardium. Okay, okay. So now the epicardium. Okay, you have the epicardium, visceral layer of the pericardium, visceral layer of the pericardium, lined by a single layer of squamous mesothelial cells. And then you have below it, you have the subepicardium, thin layer of connective tissue. During heart movements, okay, you will see that there are adipose tissues, okay, and there are lubricant fluid in this part of your heart, the epicardium. So, and then you will have your pericardial cavity. Okay, the space between the epicardium and parietal pericardium. There is a presence of serous fluid secreted by your mesothelial cells. Okay, so the layers, epicardium and the parietal pericardium, would glide. These layers would glide because there is your what you call your fluid there, serous fluid. Okay, it is important that this will not be infected. Otherwise, there will be a failure of these layers to glide. Okay, so you will have a problem there. Okay, here you have the mesothelium. You have here your epicardium. Okay, here you have your fat cells. Okay, you have here the connective tissues, and then you have here the nerve. Okay, okay, and here you will see you have your muscles, myocardium. There you are. It's part of the layer of the myocardium. Or cardiac skeleton. Cardiac, okay, skeleton. Dense, irregular connective tissue in the endocardium. So here you will see your skeleton here in between these different bulbs. Okay, here, this one here, also this one. These are skeleton of the heart, including fibrous rings around the bulbs. Now, the functions of the so-called cardiac skeleton would be anchor. They act as anchor and support of heart valves. They provide firm points of insertion for cardiac muscles. Here you are, the insertions. And then help coordinate heartbeat by acting as electrical insulation between atria and ventricles. There, take note, electrical insulation. Okay, so this is very important. Take note, because the heart, of course, they have to pump, and so they are involuntary. No? Cardiac skeletons, another part you would see here, your septum membranosum. No? You have your septum membranosum. Okay. Okay, you have your, this one, left fibrous trigon. This one here. Okay. So this would be your trigona fibrosa and the annuli fibrosa. Okay, so as you have your left fibrous trigon, okay, so you have your right fibrous trigon. So this is quite tricky because this is on the left ventricular side. Okay, this is another one, fibrous ring for the aortic valve. And then this is your fibrous ring for the pulmonary valve. So they sort of like a skeleton, no? Okay. They give tensile strength to this. Okay. There you are. And these are your respective valve. Okay. The left, this area, bicuspid, the tricuspid, and then you have your pulmonary valve in there. The annuli fibrosi, okay, so left fibrous ring, okay, there you are. Annulus fibrosus left, sinister cordis. This would be your right, okay, fibrosis, okay, dexter cordis, right, dexter. And then you have your tricuspid, and then you have your aortic valve, the mitral valve. Okay. The conducting system of the heart. So we know that your pacemaker is your SA node, sinoatrial node, the pacemaker located in your right side of your heart atrial area, no? In the right atrium. Okay, and then the excitation spreads through the atrial myocardium. Okay, so this would be the one. Then you have atrial, yes, and then you will have later on, you will have another view for this. You have your atrioventricular, okay, node, okay, and then after your atrioventricular node, excitation spreads down in the atrioventricular uh, bundle in this particular area, no? Bundle, okay. So, and then excitation spreads down AV bundle and then through the Purkinje fibers here and then here, there would be distribution of the excitation through ventricular myocardium, the ventricles, no? So let's see another view of this. I'm sorry, I think it was shown already in the second slide. Now let's proceed to the blood vessels. Tissues of the vascular wall. Again, you have your endothelium, okay, inner, and then you have your smooth muscles, okay, and then you have your connective tissues, okay, connective tissues. So here you will have your tunica intima and this single layer of cells. That would be your endothelium, the same as in the heart. And then you have the connective tissue, okay? And then you have your internal elastic membrane, or you may call this as internal elastic lamina, okay? And then you have your the muscle fibers, okay? Since this is the blood vessel, this of course is involuntary. And then you have your, of course, you have your tunica intima, the first, you have the tunica media and the tunica adventitia. And you have also here what you call the external elastic membrane. External elastic membrane or external elastic lamina. You have here the internal elastic lamina or membrane. So the endothelium, okay, it's part of the intima, and then the media, external elastic membrane with the smooth muscles, and then the adventitia, normal arterial wall. Okay, again, okay, so this is another, you have this in your book, okay, these are your subendothelium, and these are your loose connective tissue, okay, there you are. And there, this is your myocardium, okay, and sometimes you have here smooth muscles, okay. Here, you have here, what's this? This is the mesothelium or the lining epithelium. You have the intima, okay. You have your internal elastic membrane or internal elastic membrane, okay. You have your, this one is the massa muscularis, okay. Media intima, the layer, middle layer, tunica media, and then we have your tunica adventitia, okay. There you are. The walls of the blood vessels, repeat, you have your tunica intima with endothelium, loose connective tissue, and internal elastic lamina or membrane. And then you have your tunica media, concentric layers of helically arranged smooth muscle cells. And then you have your elastic fibers, and you have your external elastic lamina. And then your third layer, tunica adventitia. Okay, you have here the tunica external layer or lamina, and this is basically collagen type 1 plus elastic fibers you find at tunica adventitia. Okay, so at another view, you will see here, okay, comparing your artery with your vein. Okay, so you have here tunica adventitia. There you are, here in your vein. Tunica media, this is your tunica media, as compared to your tunica media in your artery. This is thicker, and this is thinner in your vein. And then you have your tunica intima. And then you have here your tunica intima. You do not have in your vein your elastin layer. Okay, you do not have that in your vein. So this is the lumen. And then as we go from venule, okay, to arterial, you will have your capillary there, which we will describe later on. Okay, so again, another view of a small artery and vein, small vein. So have your intima, there you are, this one, the inner, okay. And then you have your endothelium, here you are, the layer. And then you have your subendothelial layer, this will be the one. The internal elastic membrane, which is present in your artery. The tunica media, which is thick in your artery as compared to your vein. Then you have your external elastic lamina, and then you have your adventitia. Take note that the adventitia in your vein is thicker than the adventitia in your artery. Okay, but in the tunica media, it is thicker in the artery, of course, compared to your vein. So those are two distinguished characteristics of the artery and vein, plus the presence of valves in your vein. Okay, now vasa vasorum. Vasa vasorum means the vessel of the vessel, meaning to say these are the blood vessels that supplies your vessels. Okay, so could be supplying your arterioles, your capillaries, or the venules. So they are located in adventitia and outer part of media. The large veins have more vasa vasorum compared to the arteries, large arteries. So here you will see this, the wall of your artery. Okay, you have here the vasa vasorum down here, the vasa vasorum. Okay, this is nerves, no? These are your nerves. Okay, uh, this is your arteriole, of course, and then this is your this internal, external elastic. Since this is now your what your adventitia, this will be an external elastic, and this will be your smooth muscle cells. There you are. Okay, another. You have here the tunica adventitia, which we say is thicker in the vein. So you will have here vasa vasorum, okay, blood vessel, of the blood vessel. Okay. Okay. So you have your loose connective tissue here. Okay, here you are. These are parts. You have parts. The nervi vasorum is the nerve supply of the blood vessels. Vasa, vasorum, blood vessel of the blood vessels, while nervi vasorum, nerve supply of your blood vessels. These are your vasa, vasorum. Vasa, vasorum. Okay, where is it located? Also in your adventitia. Okay. It is different, no? So you see cells here, nerve cells. If you look at the microscope, these are neurons, no? There you are. There you are. This is small, capillary. Okay. So there you are. These are nervi vasorum. Okay. Now, it's important that you should know the different types of artery. Okay. So, let us start this. You have your large vein, okay, and your large artery. Large vein, okay, and your large artery. When they are said to be large artery, they are described, or rather, they are called as elastic artery. Okay, why? Because the elastic artery, they are the ones that supply blood to the remaining blood vessels, no? Elastic, so they carry more blood, so they must be, so they are called elastic artery. I need to check. Okay, so here, so take note that here in the large veins you have your tunica externa, tunica media, and the same tunica media, and the lining would be the same endothelial lining or endothelium. The same here, endothelium. But you will take note that tunica media is really thick here. Okay, and then your externa, here you are, externa, okay, as compared to this one here. And then your tunica intima with the internal elastic layer. Okay, here you don't have your internal elastic layer or lamina. Okay, next we go to the medium-sized vein as compared to your medium-sized artery, or you call them muscular artery. Okay, so if it is a medium, you call them muscular artery. If it's a large artery, you call them elastic artery. The elastic here describes the function of your arteries, and also here, muscular artery. So, medium size. Okay, tunica externa, tunica media, tunica intima, and your endothelium. The same with your hair. Okay. Okay, so we have now the venule. The venule, you have tunica externa and your endothelium. While in your arteriole, okay, you will have smooth muscle cells, tunica media, of course, and then endothelium with the basal lamina. Okay, and then we have the different types of arteries, which we will describe later on. You have after your venule or your arteriole, you will have now your capillaries. Okay, capillaries may be what you call, you have your fenestrated capillary, okay? You have the pores, may mga butas, kaya nga fenestrated, at your endothelial cells. And here you have your continuous capillary with endothelial cells basal lamina. They are not, they are continuous, no? No penetrations. Okay, so let's go to elastic arteries. Okay, so you have your elastic arteries. I said they are the big arteries. Okay, as compared to your muscular, the next level, they are smaller arteries. Aorta, pulmonary artery, and their largest branches are under your elastic arteries. So, what is the function? Conducting arteries, okay? They are conducting arteries, carry blood to smaller arteries. And then the intima, tunica intima is well developed. There are smooth muscles present in the subendothelial and then connective tissue. The internal elastic lamina is not prominent. Okay. The media is thick, alternate elastic lamella, and smooth fibers. So these are the descriptions of your media: thick, alternate elastic lamellae, and smooth muscle fibers. That those are the descriptions of your elastic arteries. Okay, function. Okay, here. Okay, okay. This is your book. Okay, this is your internal elastic membrane. Okay. Okay, this is your tunica media. Okay, of course, this is one here down. That would be your tunica adventitia. Okay, intima. Like that. Of course, you have here the first. Okay, here that is the endothelium. Okay, you have your intima. You have your media. You have your up to here, and you have your adventitia. So this is your elastic artery. Okay, now let's go to the next level of arteries. After your elastic arteries, which basically are the big arteries, you have your muscular arteries. They are called distributing arteries because they help regulate the blood pressure by contracting and relaxing smooth muscle in the media. They distribute the blood, okay, by contracting and relaxing smooth muscle in the media. And then you have your intima, okay? You have here, of course, this is an artery, so you have your prominence of internal elastic lamina or internal elastic membrane. In your media, you have more or less 40 layers, 40 layers of smooth muscle cells and elastic lamellae. Okay, these are for large, of course, muscular arteries. And then you have your adventitia. Okay, what do you find in the adventitia? You have your here, your connective tissue, your vasa vasorum, you have your nervi vasorum, okay, and your the lymph vessels, and they may reach up to the media, but basically they are in the adventitia. Now, this is your schematic diagram of your muscular artery. Take note of your endothelial cells, one's lining, no? Endothelial cells. And then you find here your internal elastic lamina or membrane. Okay. And then you have your smooth muscles. Okay. This is basically, this is the one who is responsible for the distribution of your blood. And then you have here the, what's this? Okay. This is the media, and then you have your next layer, no? muscular artery. Now, another view, okay, you will see that this is a muscular artery, okay. Well, you see this thick tunica media. Huh? This is your vein. One way of distinguishing a vein from the artery is the, okay, the opening here is round or elongated, while here you have a collapse, okay, opening of your vein, collapse. And you have your tunica media, okay, it is thinner than your tunica media in your muscular artery. Again, you see here the nerve. When you see a slide, no, this one, uh, this area here, and you see cells, that's not red cells, these are red blood cells, and these are some. You see here cells, okay, that would be a nerve, okay. This is your, what you call this? This is your arteriole, no? So you see your artery, okay, muscular artery, and your vein. The arterioles, okay. The arterioles, they indicate the beginning of an organ's microvascular. This entire one here, this one, these are the microvascular organs. Okay, so this will be now your beginning. Okay, venule, arteriole. So you have here your capillaries, and of course you have your tissue cells. The internal elastic membrane is absent in the arterioles. Okay, the adventitia is thin and inconspicuous. Okay, ibig sabihin, hindi masyado napapansin, inconspicuous. And then they are so because they are the resistance vessels, and major determinant of systemic blood pressure. Okay, these are your arterioles, and then here your so they determine the systemic blood pressure. Here's another view. Okay, so you have here your arteriole. Okay, take note that the media is always thick. Okay, always thick. It's always thick here, like this here. No? Of course, your red blood cell. You have your internal elastic. Okay, tunica intima, tunica media, tunica adventitia. Okay. The microvasculature, again, now, this is your arteriole, this is your venule. This may seem to be round as compared to this, but take note that it is by way of, cutting it. No? So, but you see that there is a thick intima. That's why you know it's an arteriole. Okay. With more blood vessels, red blood cells. Okay. The capillaries, let's go to the capillaries. They branch extensively. There are more branching. It is only a single layer of endothelial cells on a basement membrane or lamina. So one single layer of endothelial cells rolled in a tube. Okay, so you have also there the cells, the pericytes. Remember in our study of muscles, pericytes, they have the ability to what? To regenerate. Okay, pericytes. The perivascular contractile cells facilitate blood flow, give rise to smooth muscle and the connective tissue during microvascular repair. So they produce not only themselves but also give rise to smooth muscle and your connective tissue if there is an injury that occur in your area of your capillaries. The average diameter is 4 to 10 micrometer and the individual length is not more than 50 micrometer, nanometer. Yes, that's right. Not more than 50. The capillaries, most capillaries are essentially empty at any given time. They have thin walls, extensive surface area. It is slow, pulsatile blood flow, pulsating, no? Pulsatile blood flow. Okay, you see here your capillary with pericytes. These are the cells, your pericytes. There you are, no? Pericytes. This one, again, your pericytes here. Okay. Okay, types of capillaries. Okay, you have your what we call continuous capillary. You have your fenestrated capillary, and you have sinusoid capillary. Ito, I always give this in the examination. That will be in your second periodical and second bimacry. Endothelial cells, membrane from continuous tubes, no? So ito yung sa, okay. Continuous, kaya nga continuous tube, walang butas. Okay. Fenestrated, you have pores or fenestrations, may butas. Okay. And then you have your sinusoid, wider and more winding, usually large fenestrations. Okay. Allows protein clotting factors to enter the circulation. Kaya dahil nakakalabas ang proteins or nakakapasok ang protein, they are larger pores compared to your fenestrated. Okay, here you are, but we have here a better view. Oh, here. Okay, you have the continuous. Take note, no? These are continuous here. There is on the cleft, continuous. Okay. Attach the basement membrane. You have continuous. There you are. These are the lumen, and this is the nucleus of the endothelial cell. Okay. There you are. And then the fenestrated, you see here, there is fenestria, opening. There you are, as compared to this, you see? Okay. There are cleft, but these are not opening. Okay. And then these are your opening as compared to discontinuous. This is now your discontinuous. Okay. Discontinuous, these are not continuous. So your cleft is wider space as compared here. Okay. And the same, you have your nucleus. Okay. There is no basement membrane. No basement membrane. While here you have here this one. This one. Okay. It's very clear. Okay, continuous capillaries. It is tight, continuous nga well-developed occluding junctions. They occlude junctions, their connections, between slightly overlapping endothelial cells. Okay, presses muscles, you have your muscles, moves, connective tissue. And basically they are seen Continuous capillaries are seen in the lungs, exocrine glands, and the nervous tissue. So these are the parts, the areas of our body where you find your capillaries to be continuous. Okay, there you are. Okay, another view of your continuous, the basement membrane. You have the pinocytotic vesicles. Okay, so maliliit lang sila. Okay, you have your erythrocyte there. You have the cleft. Okay, you have the nucleus of the endothelial cell, and of course your lumen. This only one red blood cell passes through it. Okay, there you are. That is your continuous capillary. Now, continuous capillary is the same. This is a picture. Okay, there you are. Now, the fenestrated capillaries, they are sieve-like structure, parang sala, a sieve-like. Allows more extensive molecular exchange across the endothelium. The endothelial cells are penetrated by fenestrations, may butas. Some are covered with diaphragm of proteoglycans. The basal lamina is continuous and covers the fenestrations. Fenestrated capillaries, fenestrated with diaphragm. So when you say fenestrated with diaphragm, okay, the endothelium pores are 80 to 100 micrometer, closed by very thin porous diaphragm. May coverings siya. Pero porous and thin the diaphragm. Pag sinabi mong fenestrated without diaphragm, the pores are not closed. Hindi siya natatakpan. Okay, kaya without diaphragm. Example of this would be your renal glomeruli. With diaphragm, pancreas, gastrointestinal tract, choroid plexus, ciliary body. Fenestrated, you see that only in your renal glomeruli. Fenestrated capillary, again, you see here, your basement membrane, okay, nuclei, okay, and then you have your fenestrations. This one here, there you are. These are fenestrations, small opening, okay. This is your fenestrated capillary. So if you see it, you can describe it, no? Of course, the point where they join together, that would be your cleft, intercellular cleft. Fenestrated, you have that. Okay. Discontinuous capillaries, the endothelium lined by relatively large caliber and irregular cross-sectional outline. It is greatly enlarged diameter, discontinuous lining in walls with phagocytic cells. Phagocytic cells. You know what are the cells that are capable of phagocyte properties. Discontinuous basal lamina. They are found in the liver, spleen, bone marrow, some endocrine glands. Okay, here. Sinusoidal. Okay, sinusoidal. These are the large penetrations. Okay. Malalaki. Discontinuous. Hindi magkakarugtong sila. The basement membrane is discontinuous. And okay. And then you have your intercellular cleft, the nucleus of the endothelial cell. By the picture alone, you can easily describe them. Sinusoidal capillaries. Okay, here. Sinusoidal, nakikita saan? This is your respiratory, the lungs, no? Okay. Sinusoidal. Okay, there, area. Hindi continuous. Okay, malalaki. Okay, ang opening here. Okay. This is this. then you go to the last topic of respiratory system. Sige, go. Postcapillary venules. Okay, so smallest venule, they are formed when several capillaries unite. So this is your venule. When they form, these small capillaries form together, they form the venule, postcapillary venule. These are your capillaries. Okay, this is now your postcapillary venule. Walls are very porous, meaning to say, pwede mabaling mo, malalabasan. Okay. Primary site at which white blood cells adhere to endothelium. So when you are asked the part where you have your blood cells adhering to the endothelium, of course you have your postcapillary venules. Okay, venules, postcapillary, or you call them collecting venules, are the muscular venules. Tunica intima, single layer of flattened endothelial cells. So when you're flat, they are also described as squamous. Tunica media, very indistinct. You cannot easily see them, no? And then incomplete layer of smooth muscle. The tunica adventitia is not present in your venules. Okay? There you are, your venules. Okay? This is your arteriole rather. This is your venule. Okay? Arteriole, 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 venule, venule. Okay. There you are. You can find this in your book. Types of veins. Again, we have your large vein. Okay. The tunica externa is thick. Okay. Large externa, there is a thin media. That is your large vein. The medium-sized vein, okay, you have both, but the externa is not that large. Okay. Okay. So, and your media is not much thin to compare to your externa. Unlike this one, that is thin, and this is very large. And then the mean venule almost. Okay. So you have your tunica media, your tunica, okay, media. There you are. You have tunica intima, and then you have your tunica externa. So this is more differentiating, no? The large vein to the medium-sized vein. Small veins, tunica intima. You have endothelial cells and subendothelium are absent at times. So you have one layer of cell endothelial cells, tunica intima. And the tunica media is small bundles of smooth muscles. Tunica adventitia, thick layer of loose connective tissue. Okay, loose connective tissue, tunica adventitia. Small vein, there you are. Okay, see here. Okay, one layer. Okay, and then you have here your smooth muscle cells. Okay, and you see as compared to your arteriole, you have a bigger, no? Here. So, and the adventitia. So it's thick. Okay, but the adventitia is also small here. Okay, rather thin as compared to your adventitia in your vein, small vein. Now with the medium veins, tunica intima, thin layer, flattened endothelium, and presence of subendothelium. Tunica media, circularly arranged smooth muscles. Okay, and then you have your what? Connective tissue and your elastic. Okay. Tunica adventitia well developed and forms the bulk of your medium veins. Okay, so you see this? This is your medium artery as compared to your medium vein. Take note of the shape of the opening. Okay, thick media, almost, you don't see. And then you have your adventitia. Okay, the medium veins collapse. Okay, here, collapse. Uh, as compared, and then your media is thinner, but your okay, the external is thicker as compared to your arterial. Large veins, tunica intima, endothelium with polygonal cells. Okay, the same. So endothelium and your internal elastic membrane may not be seen. Tunica media, poorly developed, thin, smooth muscles with few elastic fibers. Tunica adventitia, greater part, this is the big part, and the bundle longitudinal smooth muscle and the loose connective tissue. Okay, and you have some connective and elastic fibers. There you are, a large vein. Oh, the intima, okay, the media, the adventitia. Okay, so you have to summarize the differential points of your artery and vein. The lumen, smaller, bigger. Okay, this is bigger. Thickness of the wall. Okay. The thickest coat, tunica media and artery in the vein, your tunica adventitia. Now, internal elastic membrane present in artery, absent in the vein. Muscle and elastic tissue more abundant than artery compared to your vein. Is prominent only in large veins. Bulbs, no bulbs in your artery, present in veins of medium-sized caliber. Tunica intima appears scalloped after death in the artery, while never scalloped after death. Vasa vasorum in artery extends up to the tunica media, while in your vein extends to tunica intima. So please do not forget this. Study this. You will see the differentiation between artery and vein summarized already. Okay, so let's go to some clinical correlates. So atherosclerosis, okay, also known as arteriosclerotic vascular disease or ASVD. Okay, so you have here an artery that thickens, so the arterial wall thickens, invasion and accumulation of WBCs, cholesterol, and triglycerides and other crystallized materials. Okay, so there is plaque formation. That's why you have your high blood pressure. Hardening of an artery is specifically due to an atheromatous plaque. Okay, so this is your atherosclerosis. O hemangioma. Okay, hindi ito parang make up or what, benign and usually self-involuting tumor of blood vessels. Self-involuting tumor of blood vessels. There is increased number of normal and abnormal vessels filled with blood. Okay. The first week of life, you can see them, grows rapidly over the first 6 months. Call that hemangioma. Cardiomyopathy, different kinds of your abnormality in your muscles, in your heart. cardiomyopathy, muscle, literally heart muscle disease, measurable deterioration of function of the myocardium for any reason leads to heart failure, you feel dyspnea, peripheral edema, irregular heartbeat, sudden cardiac death. So compared to your normal heart, you have here thickened. Okay, all the areas are thickened. Okay, the muscle fibers have stretched. Okay, so the heart chambers are enlarged. Well, this one, it is not. It is not stretched, so they can fill in the blood and then pump it to other organs, parts of the body. While this one, since it's already stretched, it cannot effectively push or distribute the blood into the different parts of the body. Okay, thank you. That ends our lecture. I hope you will study because you will have November 12th, your bi-monthly, I'm sorry, your periodic, and then on the following Thursday, you will have again your bi-monthly. Then after that, you will have your periodical and then second bi-monthly. I don't know, look at the schedule. I think it would be December is the periodical, second periodical, and next year now will be your bi-monthly. I'm not sure, you please take note. There might be changes. Thank you. And Miss Jill, are you
Yes,
there?
Doc.
Okay, you're there. How about Miss Mercado? Miss Mercado, I think you have your profile picture there because that is steady. Steady lang ang picture mo, hindi nag-iiba. Ha? Kailangan nag-iiba. O, ganyan lang ang mukha mo, lagi nakangiti. O, kaya inalis mo na. Ha? Please, don't have a profile picture. I ask you to have, no? Ayan, ganyan.
Okay, Doc.
Okay? So otherwise, if you have a profile picture on November 12th, you will get a 0 examination. Okay? 0 result in your examination. Again, please come on time. Okay? Do not overslept. I don't want that reason again. We will not give you a special examination. I don't know if Dr. Lasaka will give, but as for me, no. Swerte-swerte nyo, nakatulog kayong mabuti, tapos yung ka-eskwela nyo, hindi, nagpuyat. At tapos, bibigyan kayo ng special examination. So you get 0 for that. Yung tinatakpan mo o kanyada. Okay, next time, please come. Please attend to your classes. So, Jill, who are
Yes,
still out?
Doc.
Sino pang wala? Who are still not in?
Same lang, Doc. Si Nadera and Calapre because still brown out pa rin daw sa kanila.
Okay. So, bala ka na mag-distribute ng lecture ko sa kanila. Calapre and Nadera. Okay?
Yes, Doc.
Okay. Nadera is in daw. Nakita. Hindi. Nag-brown out kasi. Later on. Pero nakahinch niya. Si
Brown
Tan.
out daw.
Yeah. About Tan. Sinong Tan? Ano? Tan Master Jericho. Matthew. Tan Matthew Jericho. Where are you? Are you present? Wala. Jow.
Na-disconnect po ata, Doc.
Okay. Ayun, ang daming reason, ano? Anyway, you can give as many reasons as you can. They do not care. It's your problem if you fail in your histology. Remember, we have only 5 examinations. Periodicals 2, bi-monthly, and the finals. Okay? So I do not know when we shall start with the laboratory. Dr. Lasaka has not yet mentioned. Anyway, don't worry. Just study. Okay, thank you, and till